Ethical standards in gene therapy. What is gene therapy? Gene therapy is a revolutionary medical technique that holds the potential to treat or even cure genetic disorders by modifying genes at the most fundamental level. While this advancement promises to change lives, the ethical challenges it raises are profound and must be carefully considered. Gene therapy works by altering the genetic material within a person's cells to correct faulty genes responsible for disease. This technology has been effective in treating diseases like cystic fibrosis, muscular dystrophy, and certain cancers. By either replacing, repairing, or adding genes, we have seen promising results. However, like any new and powerful technology, gene therapy raises crucial ethical questions. As we enter the era of genetic medicine, we must consider the broader societal impact, not just the potential for individual treatment success. Gene therapy must be governed by strict ethical guidelines to ensure that its use is safe, fair, and just. The four primary ethical principles are beneficence, ensuring that the therapy is genuinely beneficial to the patient; non-maleficence, do no harm. Every intervention should minimize risks; autonomy, respecting a patient's right to make informed decisions about their own health care; justice, guaranteeing fair access to treatments regardless of socioeconomic status. These principles form the ethical bedrock of modern medicine. However, when applied to gene therapy, they raise new and unique challenges. A critical ethical distinction in gene therapy lies between somatic and germline therapies. Somatic gene therapy involves altering non-reproductive cells. Changes affect only the individual receiving treatment and are not passed on to future generations. This type of therapy aligns more closely with traditional medical interventions aimed at improving the individual's quality of life. Germline gene therapy, on the other hand, involves altering DNA and reproductive cells, meaning that the changes can be inherited by future generations. This raises ethical concerns that transcend the individual patient. Are we justified in making changes to future individuals' genetic makeup without their consent? Could we unknowingly introduce harmful mutations? These are ethical dilemmas that must be addressed before germline therapy becomes widespread. The topic of designer babies dominates discussions about germline gene therapy. While gene therapy could prevent serious genetic diseases, there's a real concern that it could also be used for non-medical purposes, such as selecting a child's physical traits, intelligence, or even personality characteristics. This brings up significant ethical challenges. Would allowing genetic selection create a society where only the wealthy can afford to enhance their children, further deepening social inequalities? Would we create a culture that values genetic perfection over the natural diversity that makes us human? These questions touch on fundamental issues of fairness, equality, and human dignity. Another core ethical principle in gene therapy is informed consent. As an experimental field, patients must understand the potential risks, benefits, and long-term unknowns before opting for treatment. This issue becomes more complex in pediatric cases where parents must make decisions on behalf of their children. How do we ensure that parents act in the child's best interest when long-term effects of gene therapy are still not fully understood? And how do we protect the child's autonomy in these decisions? Informed consent must be free from pressure or coercion, and patients must have the autonomy to make decisions that affect their health and future. This responsibility is crucial in ensuring ethical medical practice. Gene therapy is an expensive and resource-intensive treatment. As this technology advances, a critical ethical question is, who will have access to it? There's a concern that gene therapy will only be available to those who can afford it, creating a divide where the wealthy benefit from genetic advancements and the less fortunate are left behind. This could result in a genetic elite with superior health, strength, and even intelligence, while others are marginalized. The ethical principle of justice demands that access to gene therapy be equitable, ensuring that all individuals, regardless of income or geography, can benefit from these life-changing treatments. Establishing fair policies will be crucial as gene therapy becomes more widespread. Gene therapy stands at the cutting edge of medical science, offering hope to millions suffering from genetic disorders. But with such great potential comes immense ethical responsibility. We must carefully balance the need for innovation with the risk of unintended harm. We must respect individual freedom while considering the societal impacts. And most importantly, we must ensure that these advancements benefit all of humanity, not just a privileged few. As gene therapy continues to evolve, it is essential that we remain guided by ethical principles, beneficence, non-maleficence, autonomy, and justice, to ensure that the future of medicine brings healing, hope, and progress for everyone.